Well, we often hear about people who've had their hearts broken, but did you know it's more than just a saying? Turns out it's a pretty serious condition. Earlier, I talked to Dr. Tim Malins about this. It's in this week's Your Heart and You. Believe it or not, there really is something called broken heart syndrome. And joining me now, Dr. Tim Malins, to talk about it. This is a real thing?
Very real. Historically, we thought about a broken heart syndrome, so you see it with people with grieving, with death in the family, huge financial crisis and things, especially even with major medical illnesses. It was really first identified in Japan several years ago, and they called it what's called a Takotsubo cardiomyopathy, and what that means is an octopus pot, because the heart is not functioning well and it kind of bows out like an octopus pot, and that's how the Japanese had actually named it. And it presents just as if somebody was in classic heart failure, for which they are,
really? Wow.
But as well as you think that maybe they're having a large heart attack.
And they're not. They're
not. And so they'll come in and they can have the positive enzymes, which are indicative of having a heart attack. They can have the EKG changes, which are indicative of a heart attack. And even the echocardiogram, where you see the heart's not pumping in, is all indicative. But when you take them to the cath lab, and we've talked about that before, is where you look at these coronary arteries, the major coronary arteries, which you would expect to see a major blockage. For the most part, they're clean.
Wow. Who's at risk for this, and how do you treat it?
Well, you treat it as normal heart failure. You know, maintain blood pressure support, make sure that they're not having excess fluid on. And interestingly enough, is the population that you see most at risk, and this is really between 80 to 95% of them, are middle-aged, postmenopausal women.
Who may be going through stressful life events, I'm assuming. You know, children are getting older, incidents of divorce or job changes, whatnot, children leaving the home. I mean, is it typically just stress-related, grief-related?
For the most part, you see it with grief. You can see it with car accidents and all of those things that I talked about. And the thought is we don't really know the cause of it. And this is one of those unanswered questions, which we really would like to know the answer to, because we're seeing it more commonly. The issue is that the postmenopausal women, why is that? And the thought is there's probably something to do with estrogen withdrawal that causes probably a microvascular dysfunction, not these main vessels that we can treat, a microvascular dysfunction. The good part is the overwhelming majority of these patients, these women for the most part, can get a full recovery and will really have no long-term sequelae from this heart failure if you can get them through that event.
Wow, it's incredible. I'm looking forward to reading a lot more research about this broken heart syndrome.
Broken heart syndrome.
All right. Dr. Malins, thank you.
Thank you.
To see more Your Heart and You segments, head to our website, rochesterhomepage.net, and click on the News tab.